Okay, welcome everybody. Dr. Jen Kilgore here to talk about longevity, healing, ozone therapies, and using exercise with oxygen therapy. I am really excited about this topic because one of the what I think one of the coolest things about the medicine that I use in my office to help people recover, maintain, or optimize their health is the things that I do can be done for somebody who is very chronically ill, dealing with really tough infections like Lyme disease or mycotoxin toxicities, things like that. Or I can use the same therapies for a high performing athlete or a high performing professional to help them do even more with their bodies and their minds. The things that we do to self-invest in our health are often things that won't hurt the body if we're not in trouble, like if there's no pathology going on. So there are things that we can use to improve our performance and enhance our experience of health, especially as we age. There are certain things that no matter who you are, will change as you get older. And there's a lot that we can do to sort of combat that. And, in regenerative medicine, it's all about kind of biohacking that natural aging process. And a lot of that happens because we become very inflamed. And a part of inflammation is, and a part of just aging in general, is when we stop using oxygen really well, like we don't drive it into the cells as well, our bodies can't rebuild themselves. And that's something that's true of every single part. We are rebuilding ourselves all day long. Every body part does that at a different rate, of course. Some parts rebuild really quickly, like over hours or days, and some parts build more slowly over months. But every cell in the body rebuilds itself. And so there's this opportunity, if we can interject with lifestyle and other therapies to get the body to use oxygen, to drive that oxygen into the cell, like we did very naturally when we were maybe 20 or something like that. We're going to see more healing. We're going to see less degeneration. We're going to see that process slow down. And there's actually a good amount of evidence that we can reverse a lot of the aging process when we work on that foundational mechanism of driving oxygen into the cells. And I want to talk a little bit about ozone therapy. It's something that not everybody is aware of or has a lot of access to. It's not something a lot of doctors talk about. There are lots of medical doctors, osteopathic doctors, naturopaths like myself that do ozone therapy, but it is definitely not something every household sort of is chatting about. So ozone therapies can be applied in my office. We do intestinal insufflations, we do bladder insufflations, we do vaginal insufflations, we do IVs, we do ear insufflations, we do neti pot insufflations, we do ozonated saline. I have ozonated olive oil we put on rashes and wounds and skin. I take the gas and I put it into joints when I do a joint repair. And I do that because we see improvements in how the immune system functions. Ozone can help the body fight infection. That's a big deal for a lot of folks that come to see me that are dealing with, chronic Lyme or other really tough to, post-viral reactivation syndromes are something I see more and more of. Ozone can boost your immune system and it can bring down inflammation. So other cases where ozone is really important are the inflammatory arthritis and inflammatory GI conditions. Many people have conditions that regularly cause areas of the body to become inflamed. And there are inflammatory markers that you find in people who have asthma. There's inflammation that leads to oxidative stress. And that's often associated with painful conditions and discomforts in the body. And it is a part of why we start rapidly aging. So when we start doing ozone therapy, we will see that the inflammation improves. And the keeping that inflammation under control, and inflammation can be productive. It's also how we bring the immune system into an area to heal. But we want to keep it sort of in that productive zone. When someone has a big hot swollen joint and they are suffering from a rheumatoid arthritis, that's not productive inflammation. So the one of the main benefits of ozone therapy is to improve the immune system function. And by doing that, we can really reduce and control the unproductive inflammatory processes that a lot of people who are in pain are suffering from. Ozone is extremely antibacterial, antifungal, and antiviral. So we have a lot of resistance right now, and there, as far as antibiotics and things like that, we're always looking for better ways to treat infections, to treat, especially fungal, viral, things that we can't use antibiotics anyways for, to have ways of supporting the body and controlling infection that don't come with terrible side effects is a really big deal. And ozone is a wonderful answer for this particular issue. I also like to use it in my joints for that reason. It just sort of adds a little additional antisepsis there, which is great. So ozone is really, really helpful when we know there's been some damage to tissues and things like, I worked a lot with traumatic brain injuries. I was under supervision. I worked at Sojourners, which is a 240-bed clinic that takes care of battered women who are kind of putting their lives together after coming out of really difficult situations. And we dealt with a lot of traumatic brain injury. And, when the brain is deprived of an oxygen supply and we see the damage that comes to the tissues when that happens, the best course of action is to reduce that damage and restore that oxygen as quickly as possible. And ozone gases supplied to the brain tissue, there was actually a study in 2012 that found that a mix of oxygen and ozone gases to the brain tissue not only stopped further damage, but it reverted the brain tissue to its actual original state, which is pretty unbelievable. We also see this happen in cases of heart attacks. So if there is any kind of damage to the heart muscle, usually after one heart attack, it's not at all uncommon to have another 1 or 2 heart attacks over your lifetime. And ozone therapy can significantly reduce the chances of repeated attacks. The development of that dead tissue is from the lack of oxygen, or kind of that arrhythmia that comes with the heart attack. And the quicker you get the ozone therapy in to sort of reverse that process and start cleaning up that damage, the better. And we can absolutely reduce the risk of repeat heart attacks, which is pretty fantastic as well. Detoxification. So ozone is going to speed up the metabolism and improve your overall health. It's one of the things that we can't avoid. There are certain things that come into the body that are not things that we need for health, not things that we process very easily or metabolize very easily. So the body will have to deal with that. We've got to either get those toxins out in the bowels, in the urine, through one of the other emunctories, like the skin. Those are organs that eliminate waste. And if we can't get rid of something that the body can't break down and use for parts, we do have to store that somewhere. And that's a part of what happens in the aging process, is we have all these little heavy metals and different environmental toxins that get stored in fat tissues in the mitochondria of different cells and start to create kind of a suboptimal condition for utilizing oxygen. And those cells stop repairing themselves as well. And so we see more rapid aging. So helping the body detox, ozone is really huge for that. And ozone, I've talked a little bit about this, but it heals chronic wounds. So ozone is really, really helpful for cases of like unhealing, like diabetic ulcers. I work with really compromised guts sometimes. And I've seen this work very well on like wounds that show up around ostomy bags and areas that can be really tough to keep clean. So healing wounds is a really underutilized mechanism for ozone. It's really easy to do. In my office, I keep these special bags. We call them, they're limb bags, and we can put them over the arm or over the leg or kind of cover a part of the body and trap the gas. And there's valves on them. So I can put the concentration of ozone that's appropriate to treat kind of topically that way, and just bathe the area that's not healing well or that's infected with the ozone. And it's wonderfully supportive to healing wounds that otherwise can take a very long time to heal, or in adult compromised in adults that have, kind of compromised conditions, like especially diabetes is a big one. People aren't healing as well. Autoimmunity is a big one. People don't heal as well. Those are, immunodeficiencies, people don't heal as well. Those are places where you can actually use topical ozone in the form of, we keep it in olive oil as well. So we'll get ozonated olive oil. Can put that right on for many topical conditions, infections, works really well on the face, all kinds of things. And you can use the gas. And there are saunas. I don't have a sauna in my office, but people do use saunas as well. And to get that ozone to areas we want to do some treatment. And pain relief. Pain relief is really huge. So pain relief, I use ozone all the time in people that are, even 90-year-olds will come to me, folks that are in fairly good condition for their age, but do have like fusions or back pain and things that are just really tough to deal with. And ozone is one of the few things that we can do. And I will actually inject it just sub-Q over the areas of pain, and that alone can be very effective. There's obviously a lot of other things that I do for pain management and with the regenerative injections. But when other things aren't an option, or sometimes, especially in a compromised population, I don't always want to use an anesthesia or other drugs. And maybe something more pro-inflammatory, like a prolotherapy, just isn't a good choice, or there's been some replaced part, so it's contraindicated to do those kind of injections. Ozone is something I can often do, and I can just tuck it right into like a big swollen knee, for example, right under the skin around that knee in a few places. And I'll see the edema, the reactive edema come down and swelling come down, and pain is significantly improved. So whether I'm using other solutions to help manage pain or not, when someone's open to ozone, I will often use that. Like after a trigger point injection, I'll add a little bit of ozone in there, put 5 cc's, 10 cc's, either in the muscle or under the skin. I do it with my joint injections for the same reason. It really helps to manage the inflammation and bring down the pain level much more quickly. I get really good results when I use ozone with my injections. And another part of that is that the ozone is actually going to improve the cell's abilities, the stem cells' abilities to kind of reactivate. And there's some cell signaling that happens when we use ozone. And just like platelets kind of act like growth factors when we add those to an injection for managing pain. And we see like they kind of bring the stem cells to life, and ozone does the same thing. So that can really help with repair as well. The main purpose is cell oxygenation. And I know I've talked a lot about that, but there are so many conditions where hypoxia or like not having enough oxygen flow in that area is why there's a change that leads to something like for cancer, for example. I have really different feelings about why the body creates a cancer, and not so much for the bloodborne cancers, but for tumors that show up in tissues. One of the main problems is that there's not enough oxygen in that area in the body. My firm belief is the body is trying to create an oxygen supply with that tumor, much like the body creates a placenta to kind of feed a baby when a woman is expecting. We use the placenta as how we deliver that extra sort of blood flow and oxygen. And that's what the body's doing when we create tumors and cancers. And so it's a really fascinating way to start looking at cancer and looking at the chemistry of tumors, is to think about it a little bit more like a placenta. And it all has to do with the oxygen utilization. So that's a whole nother talk, but just to touch on that a little bit, really fascinating work in the world of cancer with ozone as well. And is ozone therapy safe? So ozone therapy is actually one of the safest modalities that I do at my office. There with the IVs, there is some heparin exposure, and that comes with a little bit of risk, just like most drugs do. But there was one study, it was done in 1980. There were over 5 million ozone therapy treatments that were examined in this study. And it was like 600 different therapists and 300,000 patients that were kind of a part of this analysis. And there were really 40 cases, only 40 cases where they had reported negative side effects. So it's pretty safe stuff. Much like the nutrient IVs and the other things we do. Again, we can do these things for people that are really high performing and really healthy, that want to improve and do even better, and sort of maximize their potentials. And then we can also, use these things to help people with the really recovering from debilitated states and really tough infections and what I call low voltage states, where we see chronic disease that's really prevalent. And so I'll move on to exercise with oxygen. I just have about 10 minutes left here, and I want to make sure that EWOT we have a few minutes to talk about EWOT. So exercise with oxygen therapy is kind of a really great marriage to the ozone therapies, and kind of for the same reasons. Like, we're still dealing with oxygen utilization at the end of the day. So for endurance athletes, like raising VO2 max is a really big thing. And it's basically a measure of the maximum amount of oxygen that the body can utilize during exercise. That's VO2 max. It's also called like your peak oxygen uptake. And when we're younger, we do this really, really well. Like in your 20s, you should be up like around 100 for kind of arterial oxygen pressure. And as we age, that goes down by 30, 40% by your 60s, 70s. There's a lot of things that accelerate age, things like smoking, things like toxic exposures, poor diet, inflammation, excessive stress, etc. All of those things lead to less oxygen going to the cells. Every one of those things leads to less oxygen going to the cells. That's a part of why you can heal so much faster when you're younger, and as you age, you see people really start to slow down in their healing process. That's often correlated with a proportional decrease in the VO2 max. Your ability to heal is absolutely affected by VO2 max. So like high performing athletes know about this, because it's one way that you can really get to that next level. And by supporting yourself, you're basically using a high concentration of oxygen while you're exercising. And you do maybe 15 minutes on, a treadmill, a bike, some kind of mild to moderate exercise under 10, 20, or 30 liters of oxygen. And that will bring the VO2 max up and improves the body's ability to heal. And it is wonderful for asthma sufferers. People with peripheral neuropathy are really helped by this. Diabetics, anyone with other like unhealing wounds for other reasons. It doesn't have to be diabetes. Chronic fatigue syndromes, people who fly a lot. brain fog, dementia, traumatic brain injuries do wonderful with EWOT. I mentioned the endurance athletes, that's a big thing. Immune support, of course, it's just like the ozone therapy is a wonderful way to support yourself. Cardiac and circulatory disorders, it's all about the oxygen. And if we can keep circulation and keep delivering those things that are so natural in our biochemistry that rebuild us, that's how we slow down and stop our aging process to the extent that we can control it. You can use these therapies in oncology support to help people that are dealing with cancers. And of course, the anti-aging is a really, that's where we hear this talked about the most. So at any rate, I hope that's a nice introduction. I know I started the talk that, and I'll kind of round back. The thing I love about all of the modalities I bring into my clinic is that I can use these to help people recover their health that are dealing with really debilitated states. And I can use these same things to help high performers do even better. So it always lets me know, like, that's kind of a big check for me when I want to do something new in my office, to make sure I'm aligning with the paradigm of regenerative medicine and self-investment planning in our health, which is really what I'm all about. There are so many different ways that we can invest in our health, in the health of our bodies, our minds, our spirits as we age. And anything that we can do to kind of add health in is amazing. I think that's just, we need as much of that as we're willing to bring into our lives, especially those of us like, you know, here in the den that want to really be living our best lives and kind of outperforming ourselves in all levels as we grow. To lean into that expansion, you have to have really good cellular function. So you have to have oxygen in the cells. We have to be able to make the ATP, make the water. We need to be able to rebuild. We are these amazing creatures, and the biochemistry is, it's there to work with that as we age. To me, there's like, I need very little evidence to prove to me that that's a good thing to do. And so these are two of the most powerful therapies that I know of in the entire world, and things that we're using every single day and are really exciting to have them here in New Hampshire and at our office. And you can find these therapies all over, but feel free to reach out if you have more questions. Feel free to reach out if you want to have a personal conversation about any of this. And thank you so much for those of you joining live, and anyone watching later. Enjoy the talk, and please come back with questions. Thanks so much.